Good evening, students. Today we'll be discussing the abducent nerve. It is the sixth cranial nerve. Approximately 6,600 fibers are present. Components are general somatic efferent, which supplies the lateral rectus muscle, and proprioceptive sensations from the same muscle will be carried through this nerve. Nuclear origin located in the floor of the fourth ventricle beneath the facial colliculus in the dorsal part of the pons. So there are total 22,000 neurons, but only 6,600 forms the nerve fiber. Remaining neurons form para-abducent nucleus. Course and relations origin. It is from the abducent nucleus in the pons, passes forward downward through trapezoid body, medial lemniscus and basilar part of pons, emerges between lower border of pons and pyramid of medulla oblongata, passes forwards, upwards and laterally in cisterna pontis, lies dorsal to anterior inferior cerebellar artery. You can see here. So this is the facial colliculus. So this is the facial nerve taking a loop around the abducent nucleus. So this is the abducent nucleus and this is the abducent nerve. You can see here, after emergence it is going in the cisterna pontis dorsal to the anterior inferior cerebellar artery, then just above the upper border of the petrous temporal and below the petrosphenoid ligament it takes a abrupt change in the direction and it passes straight forward in relation to inferior lateral aspect of the internal carotid artery within the cavernous sinus, and at the anterior end it passes through the common tendinous ring of the superior orbital fissure into the orbit. There it ends by supplying the lateral rectus muscle. So pierces dura mater lateral to dorsum cilia of the sphenoid, bends forward above superior border of the petrous temporal and below petrosphenoid ligament. So lies inferior lateral to internal carotid artery, enters orbit through common tendinous ring, inferior lateral to oculomotor and nasociliary nerves, supplies lateral rectus muscle. Peculiarities. So this nerve changes direction 3 times. First it goes downwards and forwards, then upwards and forwards, and finally straight forwards within the cavernous sinus. So two bends. One is at point of emergence, that is the lower border of pons. The other is at the upper border of petrous temporal. So communications within the cavernous sinus, it communicates with sympathetic plexus around internal carotid artery and ophthalmic nerve. And what happens when this nerve is damaged? There will be paralysis of lateral rectus muscle, which results in medial squint and diplopia. So abducent nerve, due to its long intracranial course, is commonly involved in raised intracranial pressure conditions. Thank you.